Catheters are not fun for anyone. No one likes catheters. I don't like catheters. I'm sure patients don't like catheters. No one has fun with them. If you get a CNA to help you, they don't like catheters either. If you're looking for a video on how to put in a catheter, this is not it. I'm not going to show you nor tell you how to put in a catheter. I'm just going to tell you that it's extremely awkward when you put in one. There are people that need one for various reasons. Mainly, they are retaining fluid, and the doctor wants to know how much fluid is in there and how much is coming out of them. So, they order a catheter. I don't even really think that urology likes catheters. They're just not pleasant devices. You feel bad for even using one. They're not, they're just not fun. In order to put in one, it actually takes practice. It's not something you can pick up the first time, which in itself is kind of a conundrum because you don't want to do it. I'm sure your patient doesn't want one, but you have to learn how to do one, and so you have to awkwardly place this catheter inside of your patient. I would always have at least one other person, if not 2 or 3, to help me while I did this procedure. I would always double check the doctor's orders, just like you always do. I would find me a CNA or another nurse, or a couple CNAs or a couple nurses, and go in there. I will say this, I never went into a room to do a catheter by myself. Just in case anything ever got said, I always brought someone else with me. You never want to do a procedure like that by yourself. They are not pleasant. So, that being said, I always had at least one CNA, if not multiple CNAs and or multiple nurses. Sometimes I was the spotter, we'll call it. Sometimes I wasn't the person doing the procedure. There were many occasions where I was the one assisting with the procedure, we'll say. And trying to explain this to a patient, I'm about to place this device inside of you, at times can be hard. And sometimes the patient will say, I will do anything to not have this placed inside of me. That has happened. Sometimes you can call the doctor and say, hey doc, listen, this patient says, I really don't want this device in me. What can we work out? The doc will say, well, if they produce, X number of amounts of urine within 2 hours, then you can, cancel the order. That would be great. You encourage that. I did, at least. I know some nurses who love catheters because they give them close to an exact number of output. They like that knowledge of knowing, oh, this was 250 output between 1 and 2 a.m. They like that. And for the most part, the data part of having a catheter, I do enjoy. I do enjoy knowing this was this much amount between here and here. I do enjoy that. I will say that. I do enjoy knowing the actual number, knowing the figure of how much actual output is actually coming out. That I do enjoy. But, you have to keep them clean. They are breeding grounds for infection. Just the awkwardness of putting one in is also awkward. And nurses are people too. We, may not like doing that procedure. You never know. But if the doctors order one and they have good reason, you have to do it. And it has to be done. It's something that you have to do. But when that occasion arises, get you another person in there with you and be the best that you can be the most professional that you can be when you do that. It's not fun. No. But that's my thought for the day. I hope it helps. Thank you much.